Ultrasound guidance for placement of internal jugular lines increases the likelihood of successful cannulation and reduces the risk of complications. Indication: secure or long-term venous access that is not available using other sites. Inability to obtain peripheral venous access or intraosseous infusion. For infusion of fluids and medications for patients in cardiac arrest. For infusion of medications that may be irritating to veins when administered peripherally, e.g., high-concentration fluids, chemotherapy, vasopressors, parenteral nutrition. For infusion of high flows or large fluid volumes beyond what is possible using peripheral venous catheters. Seldinger, catheter-over-guidewire, technique. Prepare the equipment. Prepare the sterile field. Insert procedural needles, local anesthetic, finder, and introducer needles, into the apical area, superior angle, of the anterior cervical triangle, just lateral to the carotid pulse, at a 30 to 40 degrees angle into the skin, aiming toward the ipsilateral nipple. Maintain gentle negative pressure on the syringe plunger as you advance to identify intravascular placement and prevent an intravascular injection. If blood returns into the syringe, stop advancing, hold the syringe in place, and now regard this needle as a finder needle. Proceed to assess the blood return below. Hold the syringe motionless in this spot. Even a slight movement may displace the needle tip from the vein. Securely grasp the needle hub and also hold it motionless. Remove the syringe from the needle hub and briefly let blood flow out to confirm that the blood is venous, i.e., dark red and flowing but not pulsatile. Carefully rotate the introducer syringe such that the bevel of the needle now faces medially, i.e., toward the heart and away from the subclavian vein. Insert the J-curved end of the guide wire into the introducer needle, with the J-curve facing medially, i.e., in the same direction as the needle bevel. Advance the guide wire through the needle and into the vein. Do not force the wire, it should slide smoothly. If you feel any resistance as you advance the guide wire, stop advancing it. Try to gently withdraw the wire slightly, rotate it slightly, and then re-advance it, or try to gently withdraw the wire entirely, re-establish the needle tip within the vein, confirmed by venous blood return, and then reinsert the wire. First, securely hold the guide wire distal to the needle and pull the needle from the skin. Then, securely hold the guide wire at the skin surface and slide the needle down the remaining length of the guide wire to remove the needle. Widen the insertion tract. Extend the skin insertion site, using the scalpel, make a small stab incision, approximately 4 mm, into the skin insertion site, avoiding contact with the guide wire, to enlarge the site and allow it to accommodate the larger diameters of the tissue dilator and the catheter. Advance the tissue dilator over the guide wire. First, grasp the guide wire at the skin and slide the dilator down the length of the guide wire to the skin. Then grasp the wire just distal to the dilator, hold the dilator near the skin surface, and use a corkscrew motion as needed to stepwise insert the dilator to pass through the wall of the vein. Maintain your grasp on the wire at all times during the insertion. Remove the dilator. First, securely hold the guide wire distal to the dilator and pull the dilator from the skin. When the guide wire is visible at the skin surface, completely remove the dilator by sliding it down the remaining length of the guide wire. Maintain your grasp on the guide wire at the skin surface. Place the catheter. Advance the catheter over the guide wire to the skin surface, hold the guide wire fixed at the skin surface, thread the catheter tip over the distal end of the guide wire, and slide the catheter down to the skin surface. The distal end of the guide wire should now be protruding from the port hub. If the distal end of the guide wire is not protruding from the port hub, incrementally advance the guide wire outward from the skin surface while holding the catheter tip close to the skin surface until the guide wire protrudes. Continue to advance the catheter into the vein, grasp and control the guide wire where it protrudes from the hub. Hold the catheter near its tip and insert the tip through the skin. Then, in increments of several centimeters and using a corkscrew motion as necessary, stepwise advance the internal jugular catheter. If ectopic heartbeats occur, slowly withdraw the catheter until ectopy stops. Maintain your grasp on both the guide wire and the catheter. Remove the guide wire, withdraw the guide wire while holding the catheter securely in place at the skin surface. Flush each catheter port with saline. First, draw any air from the line and confirm venous blood flow into the hub. Then, using a 10 ml syringe, or one of equal or greater diameter, and without using excessive force, push 20 ml of saline into the line to clear it. Dress the site. To prevent pulling on the insertion site, suture the catheter at a second site so that a curved or looped segment of catheter lies between the two sites. Apply a sterile occlusive dressing. Transparent membrane dressings are commonly used.